OK. Bonjour et merci de vous être rejoints à nous aujourd'hui. Let me just start by reminding us all that our whole country together is running a marathon, and we are not at the finish line yet. Canadians have been doing a really good job at physical distancing, and that is saving lives. I know that it's very hard, but together we need to continue. We can't stop now. We cannot squander the gains that we have made so far. And all of us need only look at other countries where we see staggering casualties, horrific scenes at hospitals, to really understand how important it is for us as a country to stay disciplined. C'est un marathon et nous ne l'avons pas terminé. Nous faisons du bon travail quant à la distanciation physique, ceux qui savent des vies. Nous devons continuer. Nous ne pouvons pas relâcher. Si nous laissons tomber, nous n'avons qu'à regarder les régions du monde, qu'elles soient loin ou proches, où les pertes sont énormes. So today, we are going to hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, the Dr. Howard Njoo, the Minister of Public Services and Procurement, Anita Anand, by video link, the Minister of Finance, Bill Morneau, also by video link, the Minister of Small Business, Export Promotion and International Trade, Mary Ng, et le Président du Conseil du Trésor, Jean-Yves. Dr. Tam, please.
Hello everyone, bonjour à toutes et à tous. I'll begin with our usual update on the number of COVID-19 cases in Canada. There are now 29,826 cases, including 1,048 deaths. Close to 50% of the deaths are linked to long-term care homes, and 93% are in people over 60 years of age. For the lab testing, we've completed tests now for over 487,000 people, with 6% confirmed positive, as Canada continues to improve our testing to better track where the disease is spreading. As I said yesterday, there are signs our collective efforts, starting several weeks back, have had an effect to slow down the epidemic. Assuming our staycation for the nation over the long weekend has helped to maintain this trend, we now need to double down to stamp out outbreaks in high-risk settings. If the measure of a society is in how it cares for its most vulnerable, this pandemic has revealed the chink in our armor. Long-term care homes and seniors' residences have been severely impacted, but there are other vulnerable groups that urgently need our attention, including people who are experiencing homelessness and precarious housing. Not having a home is a significant barrier to following public health advice, like maintaining physical distancing and hand hygiene. As well, it is important that resources and supports for infection prevention control are in place to protect staff, clients, and guests in shelters. Without immediate action, there will be more outbreaks and avoidable deaths with broader societal and public health implications. Some municipalities have taken action to secure additional accommodation to ease crowding and facilitate physical distancing. This is a good step forward. Volunteers are reaching out to support homeless shelters, including making hygiene kits and helping to serve and deliver meals to those in need. We cannot crush this curve unless and until everyone is looked after. Let's come together and do this. Thank you.
Thank you very much, Dr. Tam. Et maintenant, je donne la parole au Dr. Howard Njoo. Dr. Njoo, s'il vous plaît.
Merci et bonjour. Voici d'abord notre mise à jour quotidienne sur le nombre de cas COVID-19 au Canada. On dénombre aujourd'hui 29 826 cas au pays, dont 1048 décès. Près de 50% des décès sont survenus dans des établissements de soins de longue durée et 93% des personnes décédées étaient âgées de plus de 60 ans. Nous avons mené des tests en laboratoire sur plus de 487 000 personnes, dont 6% ont été déclarés positifs. Le Canada continue d'améliorer les tests pour mieux suivre la propagation de la maladie. Comme on l'a mentionné hier, certains signes montrent que nos actions collectives, entamées il y a plusieurs semaines, ont contribué à ralentir l'épidémie. Si l'on tient pour acquis que nos vacances à la maison, pendant la longue fin de semaine, ont aidé à maintenir la tendance, nous devons maintenant mettre les bouchées doubles pour éradiquer les éclosions dans les milieux à risque élevé. Si une société est jugée par sa façon de prendre soin des plus vulnérables, cette pandémie a révélé le défaut dans notre cuirasse. Les aînés dans les établissements de soins de longue durée et les résidences pour personnes âgées ont été durement touchés, mais il y a des groupes vulnérables dont il faut s'occuper de toute urgence, comme les personnes sans abri ou une situation de logement précaire. Quand on n'a pas de domicile, il est très difficile de suivre les conseils de santé publique, comme le maintien d'une distance physique et l'hygiène des mains. De plus, il faut absolument que les ressources et le soutien nécessaires à la prévention et au contrôle des infections soient mis en place pour protéger le personnel, les clients et les invités des refuges. Si l'on n'agit pas maintenant, le nombre d'éclosions et de décès évitables ayant des répercussions plus importantes sur la société et la santé publique ira en augmentant. Certaines municipalités ont agi pour fournir des hébergements supplémentaires afin de réduire l'encombrement et de faciliter l'éloignement physique. Voilà un bon pas en avant. Des bénévoles apportent leur soutien aux refuges pour sans-abri, notamment en préparant des trousses d'hygiène et en aidant à servir et à livrer des repas aux personnes dans le besoin. Nous ne pourrons pas écraser cette courbe tant et aussi longtemps que tout le monde ne sera pas en prise en charge. En unissant nos forces, nous pourrons y arriver. Merci.
Merci, Dr. Njoo. And now we will hear from our Minister of Public Services and Procurement, Anita Anand. Anita, please.
Thank you, Christian. Before I begin, I would like to send a big thank you to Conquer COVID-19 and Haley Wickenheiser, who have been running PPE drives and distributing personal protective equipment. Stepping up for our communities and donating what you have on hand is extremely helpful. It is the Canadian way and complements our government's tireless efforts to purchase vital supplies for our healthcare workers. We are operating in a hyper-competitive global environment, which results in complex and sometimes unpredictable supply chains. But we are making progress, which I will discuss today. Je peux vous dire qu'il s'agit vraiment d'une démarche d'approvisionnement d'Équipe Canada à laquelle collaborent tous les intervenants et tous les autres du gouvernement. D'ailleurs, je m'entretiendrai de nouveau avec mes homologues des provinces et des territoires demain. In a market characterized by high demand, we are buying existing inventory where we can and placing large orders to create and maintain a steady stream of goods flowing from diverse sources over the coming months. Pour ce qui est de nos achats à l'étranger que nous faisons surtout en Chine, nos fonctionnaires travaillent en étroite collaboration avec des partenaires sur le terrain, y compris des ambassades et des experts en logistique pour acheminer ces fournitures au Canada. In particular, we are working with Bolloré Logistics Canada, based out of Montreal, and with Deloitte Canada to provide help with transportation, receiving, storage services, and customs clearances. CargoJet and Air Canada have stepped up as well to bring home to Canada federal orders as well as provincial and territorial orders. And we continue to work with other officials in China, including our formidable ambassador, Dominic Barton, and diplomatic staff to navigate the current complex supply chain environment. Je tiens à remercier tous ceux et celles qui contribuent à l'acheminement de ces produits essentiels au pays et à leur distribution à nos médecins, à nos infirmières et à nos professionnels de la santé en fonction des besoins et aussi rapidement que possible. In addition to our international buying efforts, Canadian companies have responded en masse to our call out to suppliers at buyandsell.gc.ca. Through this call to action, we have signed contracts with suppliers like Geometric Energy Corporation, based in Calgary. This company will provide millions of nitrile gloves for Canada's healthcare workers. Au cours des dernières semaines, nous avons également entendu parler des nombreuses entreprises canadiennes qui augmentent leur production et de certains fabricants qui ont changé complètement leur chaîne de production. I'm thinking of Canadian companies like Bauer in Quebec that have gone from making hockey gear to making face shields for frontline medical workers, or Stanfield's in Nova Scotia that is set to provide us with 100,000 medical gowns per week, to name a few. Je suis très heureuse d'annoncer que nous pouvons ajouter un autre nom à cette liste de plus en plus longue. Le gouvernement du Canada a signé un contrat avec Irving Oil qui réoutillait une partie de sa chaîne de production pour produire un désinfectant pour les mains dont on a grandement besoin. Leurs produits commenceront à être livrés au cours des prochaines semaines. The Government of Canada has signed a contract with Irving Oil, which has retooled parts of its production line to produce much-needed hand sanitizer, and Irving will start delivering in the next few weeks. This is part of more than 20 million liters of hand sanitizer that we've ordered, including an order from Fluid Energy in Calgary. These companies and many others serve as great examples of the Canadian ingenuity and tenacity that will see us through this crisis. Je souhaite maintenant vous parler des dernières commandes et livraisons des produits très en demande sur le marché. So far, we have chartered 6 flights, and they have arrived in Canada, and we expect approximately 4 more in the next week carrying a variety of goods from China, including N95 masks. These flights are, of course, in addition to goods that arrive by other means. As of today, we have ordered just under 300 million surgical masks and approximately 145 million N95 respirators. To date, we have received deliveries of more than 17 million surgical masks, and as the Prime Minister said earlier this week, roughly 800,000 N95 masks were delivered to the provinces and territories last week, and we expect 1.1 million to reach them this week. Nous avons aussi commandé plus de 900 millions de paires du gant et déjà 14 millions sont arrivés au Canada. We have finalized orders of up to 30,000 ventilators with CAE, Starfish, and Ventilators for Canadians. All 3 are Canadian companies that will be manufacturing these life-saving machines right here at home. These are only some of the supplies that we have on the way and a handful of the Canadian companies that are rising to the challenge. We are operating in a hyper-competitive market, and while demand for these supplies is going up, Canada and Canadians are keeping up. Merci beaucoup. Thank you so much.
Thank you, Anita. And now we will hear from our Finance Minister, Bill Morneau. Bill, please.
Well, thanks, Christia. Good afternoon to everyone. As we come together to stop the spread of COVID-19, the government's working hard to support the economy. We're also trying to listen to the needs of Canadians so that we make sure that we get it right. We know that many small businesses are worried about paying the rent, about paying their suppliers, and paying their employees, people who've worked side by side with them for years. Last week, we launched the Canada Emergency Business Account, which is offering interest-free loans of up to $40,000 to small businesses and to not-for-profits. And 25% of that loan is forgivable if it's paid back by the end of 2022. I want to give you an update. To date, more than 195,000 loans have been approved through Canadian financial institutions. But we've also heard that there are many small businesses who need support, but who didn't qualify for these loans. So today, we're announcing that we're expanding the eligibility requirements to allow businesses that have between $20,000 and $1.5 million in annual payroll to apply. So I'd encourage those organizations to reach out to their financial institutions by phone or by email to find out how to actually apply. Aujourd'hui, nous annonçons que nous élargissons les conditions d'admissibilité au compte d'urgence pour les entreprises canadiennes afin d'y permettre l'accès aux entreprises dont la masse salariale annuelle se situe entre $20 000 et $1,5 million. Communiquez avec vos institutions financières par téléphone ou par courriel pour savoir comment faire application. The money will be there to help businesses to bridge through to what we expect will be better times. We know that in every corner of our country, small businesses are the heart of our communities. They represent the best of our country, that you can work hard and bring a good idea to fruition and provide for yourself and for your community. We also know that many organizations are worrying about their rent, the rent that's coming due. We know that we're all in this together, and I want to start by commending the landlords who are offering relief to tenants that are facing hardship. We need our businesses to remain strong so that when this is over, they can continue to be good tenants and pillars of our community. In recognition of the challenges that are facing Canadian businesses and commercial property owners, we're announcing our intention to introduce the Canadian Emergency Commercial Rent Assistance Program for small businesses. The program will seek to provide loans, including forgivable loans, to commercial property owners who provide small businesses with rent reductions for April, May, and June. To do this, we're going to need to work in partnership with provincial and territorial governments who govern the commercial property owner-tenant relationships. We'll continue to work with provinces and territories on this proposal to ensure that we can enhance support for hard-hit small businesses, and we will have more to say on this in the very near future. En reconnaissance des défis auxquels sont confrontées les entreprises et les propriétaires d'immeubles commerciaux au Canada, nous annonçons notre intention d'introduire l'aide urgence du Canada pour le loyer commercial des petites entreprises. Le programme aura pour but de fournir des prêts et des prêts remboursables aux propriétaires qui offrent aux petites entreprises des réductions de loyer en avril, mai et juin. Pour ce faire, nous devrons travailler en partenariat avec les provinces et les territoires qui régissent les relations propriétaires-locataires. Nous continuerons de travailler avec les provinces et les territoires sur cette proposition pour accroître le soutien aux entreprises durement touchées et nous espérons avoir plus à dire à ce sujet bientôt. To businesses across Canada, we want you to know that we will continue to listen to you. We'll have your back. We know that this is an extremely difficult time, and we're not going to stop working to find ways to support you and to support your employees. Thanks very much. Thanks, Christia.
Yeah, okay. Thank you very much, Bill. And now, also by video link, we will hear from our Minister of Small Business, Export Promotion and International Trade, Mary Ng. Mary, please.
Thank you so much, Christia. And Bill, thank you. Bonjour tout le monde. I'm glad to be joining all of you by video conference today. There's no question that small businesses and their employees are some of the hardest hit in this crisis. And from the very beginning, we said we were going to listen and we were going to adapt to what you tell us. This is why what we've done and what our government has done will continue until we get to the other side of this. A few weeks ago, as the finance minister said, we launched the Canada Emergency Business Account. to help our small businesses who are struggling to keep up with their operating costs and their cash flow. And under that program, small business owners can go to their local bank or credit union to apply for an interest-free $40,000 loan backed by the government. À ce jour, environ 95 000 prêts ont été approuvés. That's 195,000 small and medium-sized business owners who are getting the help that they need to keep up with your operating costs, your utility payments, topping up your employee salaries and wages to complement the 75% wage subsidy. Today's announcement to expand the eligibility criteria for this program will mean even more businesses will qualify. It means that your favorite restaurant can keep the lights on while they switch over to delivery service. It means that small furniture store that usually relies on foot traffic to stay afloat can continue to pay the costs of upkeeping their warehouse space. It means that that physiotherapy clinic can top up the wages of their rehired 5 employees to 100% along with the support of the wage subsidy. It means that the local bed and breakfast can maintain their property while they've had to temporarily close their doors. We've also heard that businesses, we've heard them loud and clear, that they're going to need help paying the rent, and that's one of the significant operational costs and that they have to keep up with, and that's what we intend to do. You've heard from both the Finance Minister and the Prime Minister that we will introduce a Canada Emergency Rent Assistance for small businesses, and this program will provide loans and forgivable loans to commercial property owners who will in turn lower the rent for their small business tenants for the months of April, May, and June. And of course, we will work closely with the provinces and territories on this, given that this falls under their jurisdiction, and we'll have more details to share soon. Il s'agit de sauver des emplois et de maintenir les entreprises en activité. This is about saving jobs and keeping businesses going. And I want to assure all small business owners and entrepreneurs out there that we are in your corner. We're listening, and I won't rest, and I know my colleagues feel the same way, until we've done everything possible to support you. Merci beaucoup. Thank you. I'm now going to pass it to my colleague. Thank you very much, Christian.
Okay, thank you very much, Mary. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
Merci, Christia, et bonjour tout le monde. J'aimerais dire un mot rapide au sujet de la situation des aînés au Québec, particulièrement ceux qui vivent dans des centres de soins de longue durée. Nous sommes tous interpellés et même bouleversés par la situation dans laquelle beaucoup de ces aînés se retrouvent présentement, la situation très difficile aussi dans laquelle beaucoup des préposés et des travailleurs des CHSLD se retrouvent aussi. Et c'est le cas du gouvernement fédéral aussi. Le premier ministre Trudeau l'a à nouveau indiqué ce matin. Le gouvernement canadien souhaite exercer sa capacité d'appui aux provinces dans des circonstances extraordinairement difficiles. Alors, pour rappeler un peu ce qui se fait déjà et ce que nous aimerions continuer à faire, donc les efforts de la Croix-Rouge canadienne que nous appuyons, je pense, sont importants. Les efforts aussi de Santé Canada pour ajouter à la liste de bénévoles que le Québec est en train de développer, ajouter à cette liste de bénévoles une liste que Santé Canada a déjà commencé à accumuler au cours des dernières semaines. Là, on comprend et on entend très bien la demande qui a été formulée au ministre Bill Blair pour un appui des forces armées canadiennes, un appui autour duquel les discussions et des décisions éventuelles ont présentement cours et seront éventuellement communiquées. Et en terminant, mais aussi souligner à quel point appuyer nos travailleurs, les travailleurs de première ligne dans ces milieux tellement importants et difficiles à la fois. Donc cet appui est absolument essentielle. Et le premier ministre Trudeau, hier, a rappelé que le gouvernement canadien souhaite accompagner les provinces, dont le Québec, qui veulent augmenter les conditions salariales de ces préposés et autres travailleurs de première ligne partout dans les secteurs essentiels de notre société, mais certainement dans les milieux où se retrouvent nos aînés. Donc, on sait qu'on veut le faire à long terme, à quel point ces services essentiels demandent que l'on appuie correctement les travailleurs essentiels, mais aussi on veut le faire à court terme. Et j'aimerais donc rappeler non seulement ce souhait, mais ce travail collaboratif important que nous avons à communiquer à l'ensemble des Canadiens, mais aux Québécois en particulier.
OK. Merci beaucoup, Jean-Yves, et on est prêt à répondre à vos questions.
Thank you, Deputy Prime Minister. So we'll start with 3 questions on the phone and turn to the room. 1 question, 1 follow-up. Opératrice.
Thank you. Merci. La première question est de Raymond Filion, TVA. La parole est à vous. Please go ahead.
Oui, bonjour. Par rapport à la capacité d'appui du gouvernement fédéral, justement, pouvez-vous nous dire quels sont les effectifs que le fédéral possède pour répondre à la demande du gouvernement du Québec? Combien de militaires, combien de bénévoles sont disponibles pour répondre à ce qui est demandé du côté de Québec?
Bien, ça fait partie, évidemment, des discussions importantes qui ont présentement lieu entre les deux gouvernements. Ça dépend évidemment des circonstances dans lesquelles les effectifs des Forces armées canadiennes pourraient être amenés, appelés à travailler aux soins, en particulier au sein des CHSLD. Donc, tout dépend évidemment des conditions que le gouvernement du Québec aimerait offrir en matière de lieu et de responsabilité de travail aux membres des Forces armées canadiennes. On sait que les Forces armées ont des compétences multiples, ont des capacités d'appui multiples. Et donc, ce qu'il faut faire, comme on le disait il n'y a pas longtemps, c'est que ces compétences s'inscrivent dans un esprit de leadership provincial, donc d'appui à ce qui existe déjà sur le terrain.
Mais combien de ressources vous sont demandées par le gouvernement du Québec? Est-ce que vous avez des chiffres à nous donner?
Bien, ce sont des chiffres, mais pas seulement que des chiffres, mais aussi des conditions de travail pour lesquelles les discussions sont absolument importantes maintenant. Le gouvernement canadien a reçu une lettre hier soir du gouvernement du Québec pour accélérer ces discussions. Donc, à la fois le nombre de travailleurs, mais encore plus important, le type de travail que ces travailleurs vont être appelés à faire font partie des discussions actuelles avec le gouvernement du Québec.
Merci, Monsieur le Ministre. Prochaine question.
Thank you. Merci. The next question is from Laura Osman, the Canadian Press. Please go ahead. La parole est à vous.
Thank you. Minister Anand, I have a question about the supplies for N95s. We're hearing from some doctors who are joining nurses' unions and calling for the use of N95 masks whenever in contact with potential COVID-19 patients to enhance their protection for those on the front line. And they're worried they might not have the supplies to accommodate that. The government is obviously trying to stock up as much as possible, but will frontline workers have enough if demand for N95s increases beyond what we're seeing now?
Thank you for the question. I will say that we have received over, just in the past 2 weeks alone, around 2 million N95 masks that are expected to be delivered to the provinces in total by the end of the week. So that's the first point to directly answer your question on numbers. But I want to give you a picture of the global environment and not sugarcoat it. We are operating in an era of high global demand, and we must watch the supply chain from start to finish until these masks and other PPE find their way directly back to Canada and are in a warehouse for distribution. And so monitoring that supply chain from start to finish on the ground in China, for example, is a key priority of our ministry and our government, and we will not stop until we have the supplies that Canadians need. We have a very solid team on the ground in China. We have been working very closely with Ambassador Barton, but we've also retained private companies, Deloitte Canada and Bolloré Canada, for example. And those companies are assisting in our efforts to ensure that we have a steady supply of masks and other PPE coming into Canada. Again, it's complex, but we are managing it under these very tight global conditions.
Follow up.
Thank you. And perhaps for Minister Freeland, I'm wondering if your intelligence officers provided you with a Canadian-produced assessment of the coronavirus threat at that incident response group meeting in late January. And if so, what were their conclusions at the time?
Laura, I am not at liberty to go into any details of intelligence shared with me and the government and other ministers. But what I can say is that Canadian intelligence analysts and officials are following and have been following from the outset the coronavirus pandemic. This is currently the biggest threat that Canada faces, and it is absolutely appropriate for our intelligence officials and analysts to be following it closely. And that intelligence is shared with the government, with key ministers, and it absolutely has and continues to inform our response.
Thank you, Deputy Prime Minister. Next question on the phone.
Thank you. The next question, la prochaine question, Hélène Buzetti, Le Devoir. Please go ahead. La parole est à vous.
Yes, hello. My question is actually for Dr. Tam. Last week you said that according to Canada's prediction, there would be between 500 and 700 deaths by today, where we now have about twice as much. So my question is twofold. A, how do you explain the discrepancy? And B, what does it tell us about the curve we're following? Last week, you presented us with 4 scenarios with 4 rates of infection, 1%, 2.5%, 5%, 10%. And we were under the impression that we were following either the 1 or the 2.5% curve. So given today's numbers, which curve do we now seem to be following?
So those were sort of planning scenarios, first of all. But let's just talk about where the epidemic is at. And we do know, and as I said yesterday, the actual doubling time for the cases, confirmed cases in Canada, has been slowing down. That's actually, that's the trend. So that you are seeing that curve bending. The issue in terms of modeling or projecting deaths, that's not even modeling, is that has to change over time. And it reflects, I think, several different phenomena. One is the epidemiology of the outbreak itself. So when the high proportion of cases occurring in long-term care facilities, for example, unfortunately results in higher fatality amongst the people who get the illness. So I think that is the current picture right now. At the beginning of any epidemic, the case fatality will be underestimated. And this is a phenomenon of both the time it takes for someone to undergo the full clinical course of their illness to the final outcome. That's sort of the numerator. Accelerates at a slower rate at the beginning, and then unfortunately after a number of weeks, those who have been infected, who are vulnerable and at high risk, will unfortunately die from the illness. So this is the phenomenon I think that we're seeing. At the same time as if the actual, so that's a numerator, sorry, at the same time as if the denominator is slowing down, when the growth rate is slowing down, at the same time as the number of deaths are going up, that ratio is going to increase. And I think that's what we're seeing right now. And we might expect that ratio to continue to increase as the epidemic slows down, but also then the population now being affected and the higher proportion of death that we expect to see in the older age groups and those with underlying medical conditions. So these projections, I think you were thinking of the short-term forecasts, are very sensitive to our actions, but also to the epidemiology, and that projection has to change really very quickly on a daily basis.
So as a follow-up then, last week we said that the expectation was maybe to have 4,400 deaths. So does that prediction change now given the situation, how the situation has evolved over the last week?
Yes, so the projections are sort of looking at a number of days out. And if you actually look at that projection, the number of cases projected very, very closely to what was predicted for April the 16th. So I think at that time we've projected the number of cases being just over 22,000 to 31,000 cases, and we're now currently tracking in that sort of time, that frame for the numbers of cases. So then is the number of deaths, and as the case fatality, that ratio increases. Again, any number that I sort of present right now will be subjected to change as the ratio changes. So our modelers at the last look are projecting anywhere between 1,200 to 1,620, so 1,620 deaths by April the 21st. So again, any number that I provide you will be subjected to variations as we change those projections over time.
Merci, docteur. On va prendre les questions dans la salle, starting with Marie K. Walsh from the Globe and Mail.
Hi there, Marika Welsh with the Globe and Mail. I'm wondering, either for Dr. Tam or for Deputy Prime Minister Freeland, if you can explain why the number of warehouses stocking supplies from the National Emergency Strategic Stockpile were reduced, and whether that led to a reduction in the amount of PPE that was also stockpiled by the federal government.
So I think the consolidation of warehouses are a reflection, I think, over time that changes in terms of the distribution of equipment. And that there are, I actually looked at that we now have 6 locations for our NAS warehouses. And they were, so supplies, for example, the Regina warehouse, as we noted, was closed. But it reflects how goods or supplies can be transported in different ways now, and more rapid ways compared to decades ago. You now have the environment for shipping and sending supplies is quite different. So that had to change with the times and with the consolidation or the effectiveness of the distribution system itself. And so I think, in terms of PPE. I think over time, I think renewal of the stockpile occurred, as we said, where we were not used to providing expired PPE to others. As we move sort of forwards, given this experience, we have to optimize product life cycle, but also minimize perhaps the disposal of expired stock. Now, they do take up quite a lot of space, but you have to sort of manage that. And, obviously there's sort of a backup, if you like, then perhaps to the non-expired stock, but that's not necessarily a practice that had been done in the past.
Right, that didn't answer my question of whether or not the same level of PPE supplies were maintained despite the closures, but I have another question for either, again, Deputy Prime Minister Freeland or for Dr. Tam. The Canadian government a number of weeks ago gave a nearly $1 million COVID-19 research grant to a researcher at the University of Alberta to work in collaboration with the Wuhan Institute of Virology. The research is to help to develop a form of rapid testing for the virus. The Wuhan Institute of Virology, of course, is from the center of the original outbreak. Can you explain why Canada is funding a collaboration with this institute and what expertise or specialized knowledge the institute can bring to bear on this research?
I think, I don't know if Dr. Njoo knows the answer to this question. We will talk to our colleagues at the Canadian Institute of Health Research or the funding organization and determine that. Obviously, though, in general, understanding the biology of the virus or some characteristics of it is, I'm sure, very useful in determining the type of diagnostics and other work that's needed. And I think, obviously all hands on deck to try and resolve the issues needed in terms of the science and what kind of testing capability might be needed. So I can't comment on the specific project, but we'll get back to you on that. I think we'll get back to you on that. What we've had, as I said, the National Emergency Strategic Stockpile was not really set up to back up the whole of the country's healthcare system. That is the responsibility of provinces and territories and their stockpile. We were more focused on very highly pathogenic and unusual organisms, such as the Ebola virus with its special kind of personal protective equipment that might be required for that sort of setting, or very, very unusual pathogens that provinces and territories are not able to or don't really have as much of a role in for preparing for those very unusual pathogens.
Van Dusen, CBC. So we know what is going on in seniors' homes is reprehensible, and seniors need help now. So the question would be, I guess, to either Mr. Duclos or to Chrystia Freeland, what specifically is François Legault hoping that soldiers will do? We know that he needs doctors, he said that, but he also said, j'ai besoin de bras, j'ai besoin de tout le monde. He said he needs everything. So would they be serving meals, doing maintenance? If you could be specific, because a lot of people want to know.
We received, as the Prime Minister said, we received late last night a formal request from the province of Quebec for direct aid from the Government of Canada and from the Canadian Armed Forces. We are looking urgently at that and are looking urgently to see what the Government of Canada, what the Canadian Armed Forces, what the Canadian Red Cross can do to help. We agree that this is an absolutely urgent situation. In terms of the precise tasks that Government of Canada personnel could do and the precise numbers, that is something which is being discussed even as we speak. There will be a First Minister's call later today with the Prime Minister and all of the premiers. I will join the Prime Minister on that call and support him. And, I want to emphasize, as Jean-Yves has already said, we are fully seized of the urgency here. We are working very hard to support the province of Quebec, as is the federal government's job. We don't have details to offer at this moment on personnel or tasks, because those need to be worked out, but they are being worked out right now.
Okay. I think this question would be also for your Deputy Prime Minister about the possibility of labor shortages in the food supply chain, unless that would be for someone else. But we know that some meat plants have had COVID-19 outbreaks, and just wondering is there any contingency plan to deal with labor shortages should it get worse?
That's an excellent question, Julie. And that is something that our government has been working on, that I've been personally focused on over the past few days. We have been talking with industry leaders. Food processors are an essential part of our food supply chain, and food security is clearly really important in a crisis like this. We are lucky in Canada because we are a major food exporter. I am so grateful to all of our farmers and ranchers and food processors. But you're right that the coronavirus poses particular challenges to food processing facilities because of the dangers of contagion there. And we're working closely with the industry to find ways to be sure we can keep the food supply chain strong and working. And I'll add just one thing, which I heard from a leader in the food processing sector this week, which is Canadian food processors are experts in decontamination. You might say that that is an area of particular necessary focus for that sector. They know how to handle this, and the government appreciates that expertise, and we're working with them to be sure that they can continue to work and that we can continue to have food in our grocery stores and on our tables. And just finally, I really want to thank all the people, all the Canadians who work in the food processing sector. These are really hard jobs. They are really essential jobs. Thank you very much.
We're hearing about a situation at an oil sands camp in northern Alberta. Now, what concerns do you have about COVID spreading at these work camps?
That is another good question. And the work camps are, of course, an area of particular vulnerability. I have had a number of conversations with Premier Kenney from the very outset about very thoughtful measures that both the province and industry are taking to minimize the possible spread of coronavirus in the work camps. And, you know, that is an effort that we need to continue. And where the coronavirus does appear, we need to be very, very swift in containing it. And I will say that the province of Alberta, the provincial public health response has been very strong to date, and I have every confidence it will continue to be.
Okay, thank you. And workers sometimes come from other provinces. So when they leave the work camps, should they be self-quarantining at home? Is there anything in place to make sure they're safe or we're safe until there's a period of time where we're all clear on that?
As you know, Mike, some provinces and territories do have in place self-isolation requirements for anyone coming into the province from outside. The provinces and territories that have put those in place have done it for a very good reason. And they expect, and I expect, all Canadians to follow those very important rules.
For Minister Freeland, Rachel Haynes here from CTV National News. President Donald Trump has talked about easing restrictions on the border with Canada. The Prime Minister said that we are still weeks away. It's too soon to talk about easing any kind of restrictions, but obviously that's being brought up with our neighbor. If the U.S. does reopen its border with Canada, would Canada then be in a position where we would have to follow suit?
So thank you for the question. And I'm happy to share with you and with Canadians that we are, you know, even as we speak, just over the past couple of days, we have been engaged in productive conversations with our American neighbors about the border restrictions. Canada believes that the right thing to do would be to extend those border restrictions. We just discussed the restrictions that exist within our own country on travel between provinces. The neighborly thing to do right now is for all of us to be staying at home and to travel only when it is absolutely essential. So the way we can be good neighbors to our American friends is by maintaining those restrictions. And we are currently having very constructive and productive conversations with our American neighbors about precisely that.
Obviously, Donald Trump, though, does have a reputation of not being so neighborly when it comes to Canada, as we've seen it over the past few years. So if they do decide not to be neighborly and open the border, can you guarantee now that Canada will not open our border to Americans until it is absolutely safe to do so?
I can guarantee one thing, and I can offer some information. What I can guarantee is decisions about Canada's border are taken by Canadians, full stop. And when it comes to easing border restrictions of all kinds, our government will only do that when it is appropriate and when it is not a risk to the health and safety of Canadians. When it comes to our discussions and our relationship with the United States, during the coronavirus pandemic, and specifically with regard to the border, the relationship has been extremely friendly, extremely neighborly, and extremely effective. We put in place restrictions on non-essential travel at the border in a reciprocal and coordinated way, and those restrictions are working. We have a huge decrease in travel across the border. At the same time, essential travel and essential trade in food, in medical supplies continues. So the relationship, in fact, is working really, really well. And we are going to keep on working hard to ensure that that continues to be the case.
Thank you, Deputy Prime Minister. We'll now turn back to the phone for 3 additional questions. Operator.
Thank you. Merci. The next question, la prochaine question est de Micheline Laflamme, Radio-Canada. La parole est à vous.
Et bonjour. Concernant la demande d'aide du Québec, le premier ministre a mentionné qu'en plus de l'armée et de la Croix-Rouge, vous allez tenir compte des bénévoles spécialisés qui sont inscrits sur le portail de Santé Canada. Alors, est-ce que vous pouvez nous dire combien de Québécois se trouvent sur cette liste? Et pouvez-vous aussi nous expliquer comment vous allez coordonner l'offre pour répondre aux besoins du Québec? Je ne sais pas si vous pouvez déjà nous donner des exemples de ce qui ont été faits jusqu'à maintenant.
Une excellente question. Alors, c'est à plusieurs niveaux que le travail se fait. Il y a autour de 30 000 bénévoles qui ont déposé leur offre de travail et de collaboration au cours des dernières semaines par le site de Santé Canada. Ces bénévoles sont répartis à travers le pays, ont différentes compétences, différentes habiletés linguistiques aussi. Et le travail collaboratif se fait bien entre Santé Canada et les agences de santé des différentes provinces, dont le Québec, pour partager ces informations, pour faire en sorte que, par la suite, le gouvernement du Québec en particulier puisse utiliser ces informations pour solliciter les expertises et la disponibilité de ces bénévoles. Alors, les bénévoles n'ont pas toujours besoin d'être physiquement présents à un endroit en particulier, parce qu'une partie du travail, par exemple, se fait pour faire le suivi des cas de contagion qui se sont déclarés, ce qu'on appelle le suivi des contacts des gens contagieux avec des gens qu'ils ont pu rencontrer au cours des derniers jours, des dernières semaines. Donc, par exemple, c'est un travail qui peut se faire à distance. On doit évidemment tenir compte des compétences, comme on le disait, de ces gens-là, mais aussi des habiletés linguistiques dans le cas du Québec. Donc, les échanges vont bien. On a évidemment beaucoup de considération pour le fait que c'est en appui seulement au travail considérable que fait le gouvernement du Québec pour mobiliser d'autres bénévoles à travers d'autres méthodes au Québec. Et donc, je pense que ce travail collaboratif est non seulement très utile, mais aussi très apprécié.
Micheline, on suivi?
Oui, merci. Le docteur Richard Garceau du Centre hospitalier universitaire du Mont à Moncton a constaté qu'un arrivage la semaine dernière de trousses de dépistage qui étaient fabriquées en Chine et qui étaient destinées à l'ensemble du pays était contaminé. Alors, on parle de 320 000 écouvillons. Alors, avez-vous pris des mesures pour que ça ne se reproduise plus? Et est-ce qu'il y a d'autres équipements médicaux provenant de la Chine qui n'a pas pu être utilisé parce qu'il ne respectait pas les critères de qualité de Santé Canada?
Thank you so much for the question. The issue of quality control of goods coming from outside of Canada, and in this case China, is one that we are watching very closely. On the ground in China, we make sure to have quality control checks there. And then on the ground in Canada, the Public Health Agency of Canada also runs inspections. And where those goods are unusable, we then move to a secondary or tertiary supply chain to ensure that we can fill the gaps that are caused by those contaminations. And so it is a constant place of attention for our government to make sure that the goods that are getting out to all parts of Canada are in acceptable use quality condition, and it is something that we take very seriously from point A to point Z. Having said that, in this particular case, it appears that there was a mishap, and it is something that we are taking very, very close watch over to make sure it doesn't happen in the future. And in terms of the inspections done in Canada, those are done by the Public Health Agency of Canada, and so it would be appropriate for Dr. Tam to add any words here.
Yes, so when it comes to the swabs, this is a supplier that's already in place. It's someone that is a supplier that's already approved by Health Canada, and so swabs can go directly and be distributed to the province and territories. When there's an issue that arises, we support the testing again of those swabs. And then moving on to looking at innovative ways to look at whether you can actually sterilize them. So that is the work that we were doing at the National Microbiology Lab, as well as, of course, then looking for replacement swabs through many different channels, including some of the domestic innovative channels as well. So again, we managed this together with the provinces and territories very rapidly in the last days.
Oui, et je voudrais ajouter seulement que concernant les écouvillons, quand on a découvert qu'on a eu un problème avec les importations de la Chine, on a travaillé très, très vite pendant la fin de semaine de Pâques, surtout moi et la ministre Anand, et on a trouvé des autres sources des écouvillons qui sont maintenant au Canada. Ils sont déjà arrivés et je voudrais assurer les Canadiens que nous avons assez d'écouvillons pour ce moment. C'est très important parce que les écouvillons sont essentiels pour faire les tests.
Merci, Madame la Vice-Première ministre. Prochaine question, s'il vous plaît.
Thank you. The next question, la prochaine question est de Ryan Timilsy. Please go ahead. Your line is now open.
Yeah, this question's for Dr. Tam. You talked obviously before about the metrics that you are tracking and the data that you are seeing. In terms of being able to start to return to normalcy, is there a specific metric that you think will be really key to the country being able to return to more normal life?
I think there's going to be quite a number of them that we'll be watching for. As I said, we have to be very careful not to call the peak early. You will not see the estimation of whether we've passed the peak until we've actually passed it. So that we have to look for very carefully. And then the trend towards the downward side of that epidemic curve, we'll be monitoring that trajectory for sure. And from a public health perspective, is do not let up on the public health measures on the way down. When you're at the bottom of that curve, that is the number of cases has been reduced, transmission dynamics. So when we talked about the reproduction number, looking at that too, making sure that the transmission is not occurring. And I think last week we talked about the concept of that reproduction number, and what we're looking for is an effective reproduction number. Of course, that is way below 1, and you don't want that to be above 1 where transmission can occur. So I think those dynamics are very important. Of course, you have to ensure that all measures are in place to prevent any further infections in those vulnerable settings. So if for long-term care, for homeless settings, for acute care, you want to make sure that it's not just a matter of numbers, and epidemiology is about making sure infection prevention control measures are in place and the health system continues to be ready for any potential surge that might actually happen in the new phase. So those are some of the metrics or triggers that we're discussing right now with the provinces and territories.
Any follow-up?
And so when you say that there would have to be infection control measures in place to prevent, I guess, like a second outbreak or smaller outbreaks, what sort of things would have to be in place, and what are you doing to put them in place?
So I think some of the capacity pieces we've outlined, and I think provinces and territories have done a great job in trying to elevate that health system capacity to prepare for surge. And so I think continuing to double up on that, making sure, for example, we've been talking about ordering ventilators, personal protective equipment, having all the infection prevention and control guidance in place so that the health system itself is ready for that surge. And also in long-term care settings, I think there's a ways to go in ensuring every one of these places and seniors' homes have the necessary measures. Of course, at the federal levels, we provide a number of guidance, but also I think you've heard the government provide a number of support so that workers, so that these different settings have the type of resource support they need to actually implement some of those recommendations as well. So also I think workplaces is important to be able to adjust to the concept of physical distancing in all of those places that currently have really been, working in innovative ways. I would say we really encourage, even in our own work context, the teleworking arrangements, but also really thinking ahead at, well, how does physical distancing actually work in our workplace? What kind of physical arrangements, workflow, lines on the floor, all those different systems might be then our new normal of how we reduce infections. And so I think all of those measures have to be in place. Of course, we'll be watching very carefully as people discuss border measures, is that to be mindful of the minimizing the importation risk. Of course, that's very important. But most importantly, I think at this juncture is that Canadians are fully engaged and know what it takes to actually reduce transmission risk, and everybody's been learning about all of those things, whether it's hygienic measures, washing your hands, covering your cough, and being able to adjust to those physical distancing measures. So there's a number of areas I think that needs to be very rapidly planned for, so that we can look towards what that new normal might look like.
Thank you, Dr. Tam. Operator, one last question on the phone, please.
Thank you. Merci. The next question, la prochaine question est de Mélanie Marquis, La Presse. La parole est à vous.
Merci. Bonjour, ma question est pour Mme Freeland concernant les négociations qui ont cours avec les États-Unis sur la frontière. J'aimerais savoir si vous avez discuté de la question des demandeurs d'asile irréguliers, parce que, sauf erreur, il y a 2 semaines environ, vous disiez que vous vouliez obtenir des garanties quand on a appris que certains de ces migrants-là étaient renvoyés dans leur pays d'origine. Alors, j'aimerais savoir comment ça progresse, ce dossier-là.
Merci pour la question. Et je veux souligner que nous prenons très au sérieux nos engagements internationaux concernant le traitement des réfugiés, et le Canada va suivre tous nos engagements, et aujourd'hui, le Canada les suit. Nous rédigerons les individus vers les États-Unis, étant entendu que les États-Unis sont également attachés à l'obligation internationale de non-refoulement, surtout concernant les individus qui sont rédigés par le Canada.
Qu'est-ce que ça veut dire précisément? C'est qu'ils font pas, ils renvoient plus les